giving them some information about your background, interests, or ambitions. The title of Aswini's speech is HR, Human Research, and the timing is 4 to 6 minutes. Please welcome Aswini.
Good afternoon, Toastmasters and fellow Toastmasters. Today I'll be talking about human research. I'd like to start with my childhood when I was growing. I was always thinking it's very hard since only thing we had to do is study all the time. We had absolutely no responsibilities other than that. When you get up in the morning, you didn't even have to brush your teeth. Your mom will brush your teeth and they'll clean up whatever, then they'll feed you, then they'll slip on your shoes and even the lace. Comparatively, I was thinking studying is the hardest thing. Then being the eldest daughter, I have a younger brother and sister, so you're even more responsible because whatever you do, they say if your sister and brother are good, they'll say oh, they're good because you're good. If they're bad, then they would say, oh, you should be good, otherwise not only you're spoiling the family or whatever. So that's what you get to have more responsibilities. And the only thing they had to do is study, as I said. Then they always parents wanted us to become mostly all the families either a doctor or engineer. That's the only options we have, nothing else. We don't know what else is happening around. So since all my cousins were doctors and maybe that's when they started the ITO starting, so engineer. So I had to choose. So of course I took the medical field. Then I was depending once I went to the school. Then after going there it was even more studying. Nothing, no. Then by final year I was pretty much contented with, I was satisfied to do whatever I was supposed to do. Then after all this was happening, then I had to come 2 years. I got married to my husband, then I had to move here. After coming here, initially when I started my rotations in the clinic, live-in clinic, I like my boss. He was a really great person. He was helping me with the transition, not only in everything, even with my education. So he was the person who was doing research all the time. So his special interest was research. So his research became my research then. I took it over, so most of the thing. So human, when I said HR, I think I was going to say, is it HR human resources? No, I said it's human research. So it's different than what you think. So I'll be telling you the stages of the research. So any drug which we take or whatever it is, this has to undergo through all the processes. First stage is preclinical stage. Mostly the drug is tested in the lab, on the animals with super lethal doses. So whatever effects have been coming will be superlative in the little the animals, mostly rats, guinea pigs, whichever animal they choose to. Then the second stage will be the subclinical dosing. This is the stage the humans would come in. Really nowadays they're starting to skip this because we only take maybe 10 to 15 people for this. So it's we don't even give the therapeutic dose. It's if the 1 mg is the dose, we probably give 1/4 or 1/3 of the dose. So we really won't see no effects. Then the second stage is stage 2 is little more. That's when we start the therapeutic dose, the regular dose which we're supposed to give. In this we'll know mostly about how the drug really works in patients. We are all these people who take are healthy volunteers. I think only places where we take real patients is end-stage cancer and the HIV patients. These two are the ones where we'll be taking the patients in this stage. Then we'll see how much the drug is needed, the dose of the drug needs to be given, and to see how it works or if it's really working. Then the third stage is I think the most important stage. That's when all the drugs would start, and this I think will be taking really huge. It's 300 to 3,000 people, and not only one center. We are doing in clinic, we do it in metro and somewhere else in Akron. So many places is where it's multi-center study. This stage is very time consuming and it's costing a lot too, because it's very long term and it's called pre-marketing studies. And in this stage is the one when we know what the drug has done and everything. And this is the stage, if the drug is good, it will go further. If they have any adverse effects or something, they might go off. Otherwise, it will go to the next stage. So whichever drug you get, it should need 2 trials to be done. So it just doesn't come to the market until this is done. So it's two more things. Then the fourth one is the post-marketing surveillance. So whenever we see the ads in the TV or wherever, then we go ask for the drug. So that's why be careful to read on the pill box. If they say this in trial, so you should have to think twice. So always prefer to take a drug which has been like 50 years or 100 years. So we know what's going to happen even with the adverse effect or the side effect. So post-marketing surveillance, I think nowadays we're getting many in this stage. This is the withdrawal stage where any report, like any adverse effect, whichever is happening in individual cases will be reported. So I think we got like many withdrawals, like or mostly cardiac drugs which will be like withdrawn from the market. And the last one is the data collection, where whatever the effects is done, you just collect the data. So this is what I do for my work, and I really like it. So anytime you do see something, and this might take 12 to 18 years, I've not gone to the fourth stage, and it will cost almost $1 billion for the drug companies, they say. So be careful when you choose.